Hello, I'm Denise Willis, Section Editor for Respiratory Care. In this video abstract, I will discuss the paper Improving Outcomes for Patients with Tracheostomy through Implementation of AARC Clinical Practice Guidelines. This paper was published in the March 2025 issue of Respiratory Care and was authored by Devlin and colleagues. The AARC Clinical Practice Guideline for Management of Adult Patients with Tracheostomy in the Acute Care Setting was published in 2021, and it included recommendations for a tracheostomy bundle, utilization of a multidisciplinary team, and weaning and decannulation protocols. The hospital involved in this study aimed to identify gaps in practice and standardize care for patients with a tracheostomy by implementing recommendations from the guideline and evaluating the impact of the changes on patient outcomes. This was a quality improvement study in a 388-bed community-based hospital. Several interventions occurred, including establishment of an interdisciplinary team, implementation of order sets and care bundles, and the tracheostomy policies and protocols were revised. Patients who were admitted during the study period with a new or existing tracheostomy were included. Patients who had overlapping hospitalization during the intervention timeframes were excluded. Subjects were divided into pre- and post-intervention groups. Outcome measures included hospital and ICU length of stay, 30-day readmissions, mortality, ventilator and tracheostomy mask days, decannulation rates and time to decannulation, and the number of physical therapy, occupational therapy, speech therapy, and speaking valve consultations. There were 203 subjects included in the analysis, with 94 and 109 in the pre- and post-intervention groups, respectively. There were no significant changes in length of stay, readmissions, mortality, time to decannulation, or ventilator and tracheostomy mask days. Although there were no significant differences in overall numbers of decannulation, patients with a new tracheostomy without COVID-19 and who survived hospitalization were more likely to be decannulated in the post-intervention period. Additionally, there was a significant increase in speaking valve and speech therapy consults. This quality improvement study found that application of the tracheostomy clinical practice guideline improved decannulation rates for patients with a new tracheostomy who did not have COVID-19, but not for overall decannulation. This may have been due to higher acuity for patients with COVID-19, as well as staffing shortages during that time frame, and bed shortages in skilled nursing and long-term care facilities that affected discharge. Use of the guideline was also successful in increasing the number of speaking valve and speech therapy consults, and this may have been related to the daily bedside rounding that was done 5 days a week. When interpreting the results of this study, there are several limitations to keep in mind. The study took place in a single-center, community-based hospital without a dedicated team or specialist to manage tracheostomy care in the pre-intervention period. The confounding variables were not evaluated, and the practices were evolving during the post-intervention period. In conclusion, implementing the AARC Clinical Practice Guideline for Management of Adults with Tracheostomy was successful in improving patient outcomes such as decannulation and interdisciplinary care. Thank you for viewing this content. Stay in the know with new content on our social media sites.